Hi, I'm Meshal Malik and you're watching Indus Special. The new coronavirus outbreak was first reported to the World Health Organization by Chinese officials on December 31st in Wuhan, a city of 11 million people. Less than a month later, the virus has spread all over China, infected more than 2,700 people at this point in time, and there have been 81 reported deaths. But it's clear the virus is spreading rapidly across the world. Australia, France, the US, Japan, Malaysia, Nepal, Singapore, South Korea, Taiwan, Thailand, and Vietnam all have reported cases. On today's show, we give you all the updates regarding the new Wuhan virus and how can individuals protect themselves. Joining us for this discussion today is Zoon, who's a Beijing-based Pakistani journalist. She joins us from Beijing. Also joining us today is Dr. Amesh Adalja, who's a senior scholar at the Johns Hopkins University Center for Health Security. His work is focused on emerging infectious diseases, pandemic preparedness, and biosecurity. He joins us from Pittsburgh. Thank you both for joining us and welcome to the show. Zoon, let me begin with you. Now, you are talking to us out of Beijing at this point in time, so you have a very good picture of what's happening in and around the capital. What is the on-ground situation like at this point in time in regards to the virus?
Okay, so Meshal, as you rightly pointed, the virus was reported some time back in December, but actually it goes a month before that as well. So this is a good context, an important context to have. In November, a few cases were reported, and at that time it seemed that the problem has been addressed. Now, today, we are standing at a point where hour by hour, the number of casualties reported is increasing. In Beijing, which is the capital, which is obviously not the ground zero of where coronavirus has struck, we still have people taking immense precautions for many days. Barely anyone is outdoors. People are advised to wear masks. The trains, the buses that are long-distance buses coming out from other cities have been banned, have been closed for now. And of course, we see that in Wuhan, there are about 60 million people that are currently in quarantine, and 44,000 people, in fact, are being observed. So there are many precautions that have been taken so far. People are being careful. They're not to travel. We still don't know how potent this really is. And of course, at the same time, it's important to recognize that the government has taken immense measures to hospitals are under construction since the scale was reported to be very high.
Right.
Doctors, even though the situation is quite intense, doctors from other parts of Beijing I guess that's as much as the government can do.
Right. Zoon, I do want to get into the specifics of what the government is doing on the ground at this point in time. But before that, I want to take a step back and talk to you about what you mentioned here as being very important for the context of this conversation, which is while it was reported at the end of December, the cases of the virus went on before that, a month prior to that. What do you think was the reason for this time lag in it being reported to the World Health Organization?
Actually, Meshal, the irony of this question is that China is being very vocal about wanting the world to contribute to the situation right now. So when the virus was initially reported in November, it was taken very seriously, but the scale was not big at all. There were just a few cases, maybe if I'm not incorrect, it was less than 10 cases, and they thought that they have addressed the problem effectively. Now, the other thing is that even though for now, the number of people diagnosed is above 2,000 and the number is increasing. We still don't know exactly how many people are affected because the symptoms show anywhere between 1 to 14 days. So the exact scale, scope, and threat of this virus is still unknown. And the other thing is that China has requested the WHO to take this more seriously. Today in Beijing, President Xi Jinping, senior health officials of China are meeting officials of the WHO. And I really hope that given that it is spreading, obviously we are living in a globalized world. There is no, it's not a national China's problem. The fact that people are traveling, the fact that we are in such a well-connected world means that this is a problem for everyone to collectively address. And that is what China is trying its best to advocate.
Right. Zoon, stay with me on that. I want to bring Dr. Adalja into this conversation and ask him. And now, Dr. Adalja, from the last time we spoke, of course, there have been many updates. There have been many more confirmed cases. And as Zoon mentioned, it seems like on an hour basis, the numbers are rising. What do we know more about the virus and its reproduction scale and the scope of it?
I would say that by now we know that this is not just something that is spreading from animals to humans, which was what was initially reported. That this has some degree of human-to-human spread, and in some cases it may be sustained. That may be more so in healthcare settings or in family clusters, but the virus can transmit from human to human. We don't quite understand how efficient it can, and you see lots of different numbers floating around for a reproductive rate for this virus. I suspect that will settle down as we get some idea of what the true breadth of infection is. We also do know that this has the ability to cause severe disease, but we don't still know what proportion of individuals get severe disease or fatal disease versus what proportion gets mild disease. And I think that's the key question, because as you see, the numbers are going up. This is spreading. Multiple countries have importations. But the really key question is, how severe is this? Is this behaving more like SARS or MERS or more like a community coronavirus? And that we just don't understand how common this was, especially if this was spreading in November or even before, which looks likely based on the number of cases, and including the fact that the first case occurred on December 1st in the major paper that was published on this. So this may be something that's very widespread, and we're seeing the severe cases that get hospitalized but don't really understand what the true breadth of infection or scope of infection is.
Right. Dr. Adalja, a couple of questions for you. The first one being that you said that there are a number of figures floating in and around regarding the reproduction rate, but there's no confirmed number that we can say that this for sure is the scale and the way it's being reproduced. Is that right?
Right. That's a calculated number based on modeling and based on epidemiological data, but there are still some basic questions we don't know that influence that reproductive rate. For example, the incubation period. Maybe it's up to 14 days. Some people are saying it's closer to 4 to 6 days. Once you know the incubation period, you can actually get a much more accurate reproductive number. But if we don't know the reproductive number and you're using multiple different incubation periods, you're going to get widely varying estimates for how this virus reproduces.
Right. Dr. Adalja, of course, speaking in technical terms, because this is the information you're surrounded with daily and working with, but for viewers who won't know what the incubation period means, what does that mean? Can you expand upon that a little more?
Sure. The incubation period of an infectious disease is the time between when you are exposed to the infectious agent and when you develop symptoms. So you get exposed, and later on, you don't instantly get symptoms. It takes some time. That incubation period, how long you have it before you get symptoms, that's really influential on how you decide when it spreads. Because if you're contagious only when you have symptoms, then the number of contacts you have before you have symptoms is less important. There is some concern that maybe at the end of your incubation period, just a day or so before you have symptoms, you might be able to transmit the virus, and that's something that's debatable right now and very controversial, but that's what the incubation period means, how long the virus takes to be able to cause symptoms once you've been exposed.
Right. Zoon, jump back to you and talking more about what's happening on ground now. As Dr. Adalja tells us about all these facts and figures coming out, what we know, what we don't know, how important has it been as a priority for the Chinese government to collect data and then also share it with other stakeholders involved, other countries involved?
Meshal, I think that there is no doubt that the Chinese government is treating this as a top priority. The extent of information that is being spread through social media is immense. People have awareness of what kind of precautions to take. Everyone has been discouraged from going out in public. People are wearing masks. Every single person I've seen outdoors is wearing masks. Public transportation is relatively empty. Of course, there are other embassies are also involved, including the Pakistani embassy, given that there are thousands of Pakistanis and a few hundred Pakistani students in Wuhan. It is important for them to ensure that these students and citizens of their countries are well engaged and they're in touch with them. So the amount of information that's being disseminated is definitely enough for people to be able to take basic precautions. And obviously, they have been discouraged from traveling. Another thing is that there couldn't have been a worse time of the year for this to happen. Right. You might already know that the Chinese New Year is the largest human migration in modern times. And this is a time when Chinese people are traveling. Almost every Chinese person is traveling. So the likelihood of spreading, the likelihood of exposure is multiplied. So in order to take these measures was obviously difficult as well, because, for instance, going to temples is very common for Chinese people during New Year's. Such things were stopped. People are being discouraged from going to public places. And the other thing is that You may also know that some countries are thinking about airlifting their citizens from Wuhan. How smart that really is, maybe that's questionable for sure.
Yeah, and that's the question, Dr. Adalja, I'm sure you can give us better insight into. How smart is it to airlift citizens? Of course, every country wants to protect their citizens. We're talking about evacuation procedures here. How smart is that idea?
I don't really have any objection to evacuating citizens. What you have right now is a blockade of parts of China that have made that area a no-go zone, where there are shortages of food, shortages of medical supplies, a lot of public distrust of authorities there. So even without the virus being present there, it's become an area that I think is not something that's conducive to wanting to be there. You know, the CDC in the United States has made this an area where you should not be traveling to. So I do think it makes sense to remove people from that area if they can be removed from back to their home countries. Obviously, those people need to be screened just like other travelers for incubating that virus and watched and monitored until they are clear. But I do think that this is something you have to do based upon the actions that the Chinese government has taken there to make that place basically unlivable.
Right. Zoon, you'll be better able to tell us about that on-ground situation that Dr. Adalja is mentioning, that the government is, of course, taking very stringent measures to control what is happening, but those measures are also making the place unlivable.
Meshal, I think to say that Wuhan is unlivable because of precautions that are necessary to protect not only the people that are in that situation, but also the ones outside is maybe a little harsh. For sure, if you ask me, I mean, let's say that the hundreds of Pakistanis that are there, the kind of facilities that are being provided in Wuhan right now for people that could potentially be victims of this virus are much better. And the people over there, the doctors, the medical staff over there is much better equipped to deal with that situation.
Obviously, and what are those facilities? What are those specific facilities that you're talking about here that they are unparalleled and this is what is being provided by the government? Could you give us more insight into those facilities?
Just the fact that, okay, for instance, right now, maybe you already know that a few days ago, the government is under emergency constructing hospitals. A lot of research and development is going underway to understand how to tackle. They are better experienced, to say the least. And I think that is one major aspect that makes any medical staff capable of addressing an issue. So the point is that is there another option? What are the risks involved in making Wuhan open to the world right now, or actually airlifting citizens? Will those people be showing symptoms? We still don't know if the maximum incubation period is 2 weeks. It probably is. But right now, from what we hear, the virus is getting stronger. Now, what does that mean? Does it mean that it could have a longer, shorter incubation period? Maybe, obviously, Dr. Amesh is in a better position to answer those questions. But I do think that the basic bare necessity is being met. I personally know a lot of journalists, staff of different research institutes, and obviously medical doctors, young medical staff that are voluntarily in China, other parts of China, going to Wuhan. And I personally know people that chose to stay in Wuhan when the government said, you have 8 hours to leave. After this, the city will be in lockdown. They chose to stay there because they said that we're already here. So if we rather than making it a bigger problem,
right.
Some of them
Zoon,
really chose
Zoon,
to
stay with me. Stay with me, Adalja. As you stated that place is unlivable. Of course, Zoon differs from your opinion there. But what do you think can be done differently by the Chinese government in this situation? I mean, of course, there's an environment of complete panic. Many things are happening at an ad hoc basis because of the nature of the virus, which is largely unknown. But what can be done differently?
When you are dealing with a public health emergency, the thing that you need the most is compliance from the population and trust of the population, and you don't want them to be panicked. When you close off a city using armed guards at railway stations, you are going to create a lot of distrust among the population because you're going to make them feel as if they're abandoned. We are already hearing of shortages of medicines, shortages of doctors, shortages of hospital beds, shortages of food, price increases of food. That's not how you want to manage an outbreak. You want there to be the ability to get resources in, get resources out, and you don't want people to feel that they've been abandoned or isolated there. And I would say if there are shortages of beds and shortages of doctors there, it's not conducive to controlling this outbreak, and it may make things worse in that outbreak and increase the intensity of spread there. We know that travel bans don't work. We know that armed quarantines are bad. We saw it with Ebola in 2014, that those quarantines made it worse. So despite this being something that people think is necessary, it's not a false alternative that you leave Wuhan open to the world versus an armed an armed quarantine.
But leaving Wuhan open to the world might lead to greater risk of spreading the virus. Is that true or is that false?
Well, I didn't say that. I didn't say leaving Wuhan. I said it's not a false alternative. You can institute travel warnings to those areas. You can screen people leaving from there. But I think that having military and guns there to enforce this outbreak, cordon sanitaire, is not the best way to manage this. And I think it will make it worse in the outbreak zone.
Right. Zoon, last question to you before we end the segment here now. Leaving this aside, Dr. Adalja says that there are other alternatives to how the government is handling this. But what I do want to talk to you about is the number of foreigners within China, within Wuhan specifically. You mentioned this earlier as well. The embassies coordinating within amongst each other. What are some of the steps being taken? Is there serious talk about evacuation, even though we're hearing that Wuhan is completely closed off?
Meshal, I think that obviously we should leave these kind of decisions to experts for now. The decision that was made to keep Wuhan in relative quarantine has been based on some experience that they have as well. I don't think it would make sense to think that this has caused a state of panic, because a lot of people are there and they're in this collectively. And I think the level of trust that people have in this
I agree.
is definitely different.
Dr. Adalja and you have different perspectives on that. But what is on the basis of evacuation?
So right now, I think that whether or not citizens should be airlifted is under consideration. And if that is going to be the right decision, I think only time will tell. But for sure, to airlift those citizens, we would need to take various precautions. And I think that is something that the experts, the Chinese government and the governments of countries involved, where they have already reported cases, are considering. So that said, I mean, I think we still don't know the right answer to that question. But hopefully, the last thing we do need is panic. And the last thing we need is this spreading out without us knowing how to address it.
Dr. Adalja, just one last question. How much more information do we need to start a global coordination of events? I mean, there's clearly a different perspective between you and Zoon here. Many that would be all across the board here. How much more information do we need at this point in time to know more about the virus?
There's lots of information needs. We still don't have basic epidemiology. Like I said, we don't understand the incubation period. We don't know how efficiently it transmits. We don't understand what the severity of infection is as opposed to how many mild infections occur. We don't know the origin of this virus. All of that is very important to be able to develop a response plan, because the more we know about the virus, the more we can tailor our response to contain it. And I think that those questions need to be answered sooner rather than later, because this outbreak is going to continue to increase until control measures are instituted. And it's only when we know these basic facts about this virus that we'll get it. There's been lots of science done in the last several weeks about this virus, basically unprecedented, but there's always a need for more, especially as we see the acceleration of transmission occurring.
Right. Thank you so much on that point, Dr. Meshal Adalja, for joining us from Pittsburgh, and Zoon Ahmed Khan for joining us from Beijing. We're going to go for a short break, but when we return, we're going to discuss further about what can be done to contain the Wuhan virus and what more steps need to be taken. Stay with us. Welcome back to Indus Special. While we discuss the new coronavirus and how it's creating panic all around the world, what more steps need to be taken, what more information we need to know to contain the virus. Now joining us for this discussion is Dr. Vinya Ariyaratne, who is a specialist in community medicine and president of Vodya Sarmada movement. He joins us from Colombo. Thank you so much for joining us, Dr. Vinya. Also joining us today is Dr. Munir, who's a virologist at Lancaster University. He joins us from the UK. Thank you so much for joining us as well, Dr. Munir. Let me begin with you, Dr. Munir. Now, we've been talking about the reproduction rate of this virus, and we see more and more cases being developed by the hour. Do we know whether the virus is increasing in how viral it can be?
When we talk about reproductive ratio, that means how many people can be infected from one sick person. So if we look on to the infectiousness of these viruses, different viruses have a different reproductive rates. For example, measles can infect, one infected person can infect 18 people. And influenza virus, 5 or 6 people can be infected from one single person. So they are very infectious. So when we talk about coronavirus, this is especially Wuhan coronavirus that has emerged late last year in China, this is having a reproductive rate of 2 to 3, which means that one sick person can infect maximum 3 people at this moment, which is not highly infectious. That's why probably the spread has been limited. But these kind of viruses, which are RNA viruses, they have a great potential to mutate, to change their shape over the time, and then they become highly infectious. So which means that if it's sustained in the population for a longer time, they acquire those mutations and become much more fitter. And if they become much more fitter, they will be transmitting from one person to another person more frequently. And if that does so, the overall spectrum of infection would be wider.
Right. And you're saying that they can mutate. Is this virus specifically, has it changed its form in the time period that we've known for it to come into being till today?
So when we talk about a virus is mutating or not, how we do it in scientific terms is that we take the virus that has been isolated on the first day, and then after 1 month, we take more viruses, and then we look for their genetic makeup. And then what we do, we compare these genetic makeup from first day to the 30th of day, and then we'll see if there were any change occur during these 29, 30 days. So if we look onto the viruses, we have around 20 different viruses that have been sequenced from this outbreak. If we look onto their genetic makeup, they did not significantly change. There has been some mutations, which mean a specific spellings have been misspelled from the viruses that has been isolated from China and also from the United States. So the rate of mutation is not very high at this moment. And that is probably because the virus has not been moving from one person to another person for several generations. Although there are chances that at least fifth generation has been infected, which means one person had passed on to second person and second to third, and similarly gone to 5 generation. So if we keep an eye on these viruses for a bit more longer, we will be able to say something conclusively whether this specific virus is mutating and that mutation has any impact on to the overall disease outcome.
Right. I just want to jump to Dr. Vinya Ariyaratne and talk to him about the situation is there in Sri Lanka. How are the governments responding, especially the ones in Asia? Now, Dr. Vinya, can you take us through the measures that are being taken to screen individuals to ensure that if any suspicion arises, how are individuals treated? How is the procedure like?
Yes. So at the moment, the government has taken all the precautionary measures from the day that it was reported that the infection has now crossed borders and there is a possibility of the infection being spreading to other countries. The travelers arriving in the country are advised on board now to report to the help desk, which is set up at the airport and also in the ports that are they are in Sri Lanka. So there is a help desk operating and all the passengers are screened for any signs and symptoms, particularly heat detectors are there for passengers to detect patients with passengers with fever. And then we also have, and this help desk is operative around the clock. And just today, the government announced that there is a special terminal now open for those passengers who are coming from China, because there are some Sri Lankan Airlines flights which are operating directly to some cities in China. So our public health system is very robust and they are very much in alert now. And any person who is presenting with any possible signs and symptoms of symptoms that are suggestive of coronavirus infection are then sent to for further investigations. We have a special hospital, infectious disease hospital, which is now on alert and receiving patients who are having these signs and symptoms. So far, only 4 patients have been reported, and they have already been tested, and they are tested negative for coronavirus so far. So, in addition, the public is being always kept informed to take general universal precautionary measures and report to any health facility if they have a history of travel, because we know the epicenter is in China. So those are the steps that have been taken so far.
Right. Vinya, that's an important point you're making there about the communication between the government and the public, specifically at a time like this when there is a panic all across the board, not just in China, but all across the world. Any travelers you're receiving from different countries. To that point, I do want to introduce Mr. Einar Tangen, who's an analyst who's just joining us from Beijing. Thank you so much, Mr. Tangen, for joining us and taking out the time. Now, earlier in the show, we were having this conversation about the public trust in the Chinese government at this point in time, and whether it has been eroded with the measures that are being taken in Wuhan, or whether the government is actually, in fact, communicating with the public in a way that it should. Now, comparing this to the SARS outbreak in 2002, 2003, do you see a noticeable difference in how the government is dealing with the situation?
Yes, I mean, China is a place where they learn very quickly from past experiences, and what you're now seeing is an unparalleled level of transparency. The Chinese people are extremely concerned, but they, in general, and I'm not talking about social media and individual reactions, people are very confident the government is, taking the right steps, giving out complete information. And this is something that's very, very important. I mean, this happened in China, but quite frankly, this is a precursor to what could happen internationally, some sort of pandemic.
Right.
I mean, the refrain that you're hearing constantly is this, that, well, China can do that. They can build a hospital in 6 weeks. They can shut down, travel between cities for 54 million people in over 20 cities. This is not something that can be done in most countries. So this is quite extraordinary, and it will be a situation where the rest of the world will be measured by how China responds to this.
Right. Mr. Tangen, just back a bit and talking about the unparalleled level of transparency that you're referring to. How is the government ensuring this at this point in time, not just with its own people, but internationally with other governments, with the World Health Organization?
Well, it's been, on the scientific side, it's been quite very, very good. I mean, what they've done is they've decoded what they believe to be the entire genome of this particular virus. They broadcasted it, and they're making sure that that all of the scientific community is well aware of exactly what the dangers are. Now, this virus is unique in the sense that people can have it for 3 or 4, even 5 days before they become symptomatic. And this is the greatest danger, because people, once they become symptomatic, you can detect the high fever and things like that. But prior to that, they don't know, so they don't know that they're transmitting. So this is one of the things that the Chinese government does. They've gone overboard on making sure that they are taking the most conservative measures to do this. I mean, right now, you cannot get in and out of Beijing. I mean, this is the capital city of China. They have shut down, in essence. You could come in, but going out is very, very difficult. If you're coming in from a local province, it's completely restricted. They're allowing goods to come across, but not people.
Right. I want to talk about the implications of this on a larger scale, Mr. Tangen. But before that, I want to talk to Dr. Munir about something that you mentioned here. Now, China is going overboard in trying to take precautions for this virus, but we're seeing not that level of alarm across the world, not one to match China's, of course. Now, the World Health Organization refrained from declaring this as a public health emergency of international concern. Would you agree with that decision, Dr. Munir, of not declaring it as a health emergency?
Well, I would like to echo what Einar has been saying, that the control measures, especially onto locking down cities and discouraging gathering and all those restrictions that are being put in place in China, these are unprecedented. These have never been done in the history of science before. These are wonderful. However, I must like to emphasize onto the fact that horse has already left the barn. The people who are already infected, they are out there, not only outside the contained areas, but also abroad. Having said that, the control measures that are being put in place by China now, these are really the break for the WHO to put any emergency in place for a couple of reasons. In the past, we have had such outbreaks, for example, SARS or MERS or 2009 swine flu. Those have been contained without having drugs or the vaccines available. All those have been done by containment. One such example is the 2009 swine flu in Mexico. When it started, they locked down all of their theater, cafe, restaurant, and all of the public gathering. So that definitely helped to sort of contain the infection, but it did not fully help to sort of overall eliminate the infection. So I think whatever effort China is putting at the moment, these are smart moves, but I think it is sounding very bad onto the people, what we see from the overseas.
Of course. And as you're saying that the horse has left the stable, many people are out there with the infection. It goes back to my original question here. Why isn't this being declared as an international emergency? Why aren't countries scaling up to that, or let alone countries, but why isn't the World Health Organization declaring it?
So WHO has one committee they called Public Health Emergency for International Concern. They established in 2000 basically to tackle such type of infections. So whether to consider this one as a threat to the globe, so that they can call it a pandemic or not. So they have certain parameter to look into whether these parameters are met before they can declare an emergency. So if we specifically look into this infection, it has a great emergency for China or probably Hong Kong, but this has not spread to that greater level to the rest of the globe. So therefore, the concern for global perspective is not that high compared to what we are seeing in China. And also, there are two other strong beliefs which last week WHO found the basis not to declare as an emergency was that only 25% of the infected people, they were having severe infection. And it was mainly the people who were older and already having underlying causes. Those were the ones who died because of the coronaviruses. So according to their definitions, what is called an emergency or what is not called as emergency, this infection at that point did not fall into those categories. Therefore, they were not able to declare as a public health emergency.
Right. Mr. Tangen, jumping back to you, talking about the media projection, especially coming out of China regarding what is happening now, you're saying that they're trying to make the system as transparent as possible, but there must be something at the back end for this. When they're telling the world that this is the situation that's ongoing here, there is a sense of emergency that they're communicating to the world. Given that, do you believe that this could be an emergency of international proportions?
Well, of course, it's an emergency. I mean, there's a very different perspective when it comes culturally to China and, let us say, the West. I mean, my colleague has mentioned that this does not fit WHO standards for an emergency, but in China it does. Culturally, the idea that somehow that elderly people are expendable because, this will only take a small percentage of them is not acceptable here. The government is responsible. And this is something that comes up in regards to many other issues, whether it's Hong Kong, Xinjiang, etc., Taiwan. The government is always responsible for maintaining the public health and safety. So from their perspective, they have no choice but to take this extremely seriously, regardless of how the international community. I mean, to give you an example, the German health minister came out and said, well, look, we have 20,000 people a year who die from flu. This is not something that is beyond what we deal with on a yearly basis. But this is, as I said, a different cultural perspective than the Chinese have. The idea that somehow the government would acquiesce in terms of elderly people dying, young people dying, infants dying, would be anathema. And it would be very, very, there would be a sharp reaction from the public. So from the Chinese cultural perspective, this is an emergency, even if it is not an emergency from the Western perspective.
Right. And Mr. Tangen, I want to talk a little about the other dimensions of this. When you're talking about there being travel restrictions, restrictions on movement completely in many parts of China, the economic implications of this, could you shed light on this? What is the government fearing? What are we seeing right now? What can we expect?
Well, I mean, the government has put economic concerns on the second place. What they're really concerned about is dealing with this. SARS took 6 months to deal with, and there were many mistakes. The government was not transparent. A lot of local officials tried to hide it and things like that. And Xi Jinping has taken this issue over directly. There's no question that the government's credibility is on the line. They intend to deal with this. But let's think of it in these terms. Let's say you isolated 200 million people, 400 million people. You'd still have a billion two people that you have to inoculate in order to make sure this thing does not spread. I mean, it's a dense country. The kind of economies of scale that we talk about that are economically advantageous to China are not advantageous when you're dealing in this kind of situation. So, right. Yes, China will take extraordinary measures possible. So, yes, they're taking the right actions from the Chinese point of view.
Right. Dr. Munir, now, in the countries where this has spread and the countries that are fearing specifically in the Asian region, what precautions can people take from this virus, individual precautions specifically?
Yeah, so the virus, the Wuhan coronavirus, it caused a respiratory infection, meaning the lungs would be involved, there would be difficult breathing, there would be cough, and there would be fever. So the first thing that as an individual one need to make is to avoid any contact with people who are having these kind of clinical signs. They should stop eating the meat that is uncooked because we are having stronger evidences that these kind of viruses come from animals. And these people who ever see any fever or having contact with susceptible patients, they should report to the public health authorities so that the screening can be done. One thing that is becoming a lot more important in the current time is that the virus is spreading from people to people without causing any clinical sign. So person apparently looks symptomless, but still there would have been a virus breeding in them. So that is the critical point for any control authorities to put restriction in place, like how can you identify those infections when you cannot see clinical sign? So any person who are having any contact with susceptible or infected people, they think that they are in contact with those people, they should report to the public health authorities so that they can probably be screened and also contained under that content situations.
Right. And which places are the hot sites, if I should?
Yeah, the virus is highly infectious and contagious, which means that it can transmit from people to another people very effectively.
Much for patiently while this conversation was ongoing, but an important thing that Dr. Munir mentioned was that there are symptoms and many carriers of this virus don't display any symptoms at all. This is all very complicated information. How do you feel like the government in Sri Lanka and other governments across the board can make this information accessible to masses and the public in general?
Yeah, so in Sri Lanka, we have a generally, because of the high standard of health that we have maintained over the years, public is generally very conscious of their health, and sometimes, of course, they overreact as well. So I think so far the government information system has been quite a problem, except that for example, yesterday there was a news that everybody is advisable to wear face mask, which is not required at the moment. So, and especially you can't have measures that will, jeopardize the daily lives of people also. So you have to weigh. We know that there is a big risk, but at the same time we know that there is a specific pathway of infection, and therefore at the points of entry, certain measures have been taken. So generally it has not been a problem, but we have to wait and see how things evolve, because so far...
So the preventive measures that you're mentioning here, Dr. Vinya, the fact that there haven't been any confirmed cases, people should still amp up precautionary measures. Isn't that true?
Yeah, I mean, these are general precautionary measures. Those who are at risk due to their history of travel and contact with people who have these symptoms. So it is at the moment limited. So because of that, we are in a position to contain. But of course, things change every hour. There are hundreds of tourists who are coming, and there are also large numbers of Chinese workers in worker sites who have gone to gone back to China for the Chinese holiday. They are returning. So I won't say there is people in community health issues. We are also being now mobilized to take that message to the public.
Right. Dr. Vinya, that's the way you're talking about this. This, of course, brings me to ask Mr. Einar Tangen, what international standards can be established following the Chinese model that has been created specifically for the screening of individuals and reporting whether there are any suspicions of a case or any confirmed cases? What are some of the things that countries can take out of this?
I think that you have to be more proactive. Sri Lanka, although they have had no reported cases because they are a tourist destination, because there are a lot of Chinese there, they should be taking very proactive measures, even to the extent of putting people in a 3-day, 4-day quarantine coming from China to make sure that they're not going to spread it. This is not a joke. This is something where you can't wait and see what happens. This is something where governments have to take proactive measures. You can't say that elderly people and young people are expendable. I'm quite surprised actually by his reaction. This kind of wait and see and what happens and this type of thing is not the way to do this. This is an infectious, highly contagious disease. It needs to be dealt with seriously. And I think China has shown a gold standard in this regard.
And what are some of those things that people can follow from that? Since we're running short on time, I'd like you to highlight those specific measures that can be taken, especially at airports and other scenes.
First off, they have to take temperatures. People coming from China need to be quarantined 3-4 days before they can come in. And that means active monitoring. You need to know exactly who they came in with, because in an airplane, it's a highly infectious environment. There needs to be some sort of temperature control. They need to be followed. They need to make sure that this is not going to contaminate the local environment. I think this is the only responsible thing that governments can do.
Right. On that point, thank you so much, Mr. Tangen, for joining us from Beijing, taking out the time. Thank you, Dr. Vinya Ariyaratne, for joining us from Colombo, and Dr. Mohammed Munir for joining us from the UK. Thank you for watching Indus Special. Hope this episode was helpful in trying to become more aware about this new virus and to take more precautionary measures. We will see you again tomorrow with more stories. Till then, goodbye and take care.